So it was a very heavy packed session, so I kind of tried to introduce all the applications that we have now available. I think the main points are that ctDNA is here to stay, and we may use that for molecular profiling when we have patients with advanced disease that we want to make sure they don't have those targetable mutations that really can guide the therapeutic decision. So you may do that on a daily basis in your clinic, and if you do find one of those genes, you can act on it. You don't need to wait on the tissue next generation sequencing. That's number one. Everything else that I'm going to tell you that is highlights, it's not something that for the majority of cancers we can use. So for instance, MRD detection. This is an area that is, there's a lot of research, but only colorectal cancer we have commercially available platforms to detect minimal residual disease. But for the other solid tumors, this is only in the context of research that clinicians should order that. I wouldn't order that in a day-to-day clinic, because what are you going to do with the result? Because you cannot act on it yet. So you're just going to make yourself anxious and the patient's anxious. The other thing that we may do is molecular response, meaning that let's say you start your patient in a therapy and you want to see if they are responding early on. There are assays that you can test, but then again, what are you going to do with that result? It's not like you're going to change your therapy. So the only application that I think is valid is sometimes we have patients with CAT scans that we don't know if the disease is growing or if it's a treatment-related change. That's when this test is valuable, because then you can rest assured that this is working and you don't need to repeat the scan so soon. And the last thing is early cancer detection. This is an area that there are big studies in Europe and also here in the States testing different platforms, but that's not something you should order for cancer screening as of now. It's on its infancy, in my opinion. So those are the main applications.